Some community organizers are calling for the city to reopen mental health clinics. In 2012, Mayor Rahm Emanuel's administration closed half of the city's clinics. Mayor Lori Lightfoot campaigned on reopening the centers, but has focused her tenure so far on investing in organizations that provide mental health care. This fall, the city announced 32 organizations on Chicago's south and west sides would receive $8 million to expand services. Joining us to discuss calls for the clinics to be reopened and the city's mental health initiatives are Diana Castaneda, Director of Youth and Crisis Services at Community Counseling Centers of Chicago, which is among the organizations receiving funding from the city. Arturo Carrillo, a licensed clinical social worker and leader of Collaborative for Community Wellness, a group working to address access to mental health care in Chicago. Matt Richards, Deputy Commissioner of Behavioral Health at the Chicago Department of Public Health, and Amika Tendaji, Director of Black Lives Matter Chicago. She's organized around reopening the mental health clinics with Stop Chicago. Welcome all of you to Chicago tonight. So earlier today, we spoke with Woodlawn resident Horace Washington Howard about how the clinic closure impacted his mental health services. He says he used to live just blocks away from the Woodlawn Mental Health Clinic before it closed. Let's listen.
The closing of the Woodlawn Clinic impacted me very much so. At that time, it took almost 3 to 6 months to even get a therapist. And now I was traveling by air and bus to Lawrence, which is 40-some hundred north.
Arturo Carrillo, remind us what impact the closure has had on residents in the communities they served.
Yeah, it's already exacerbated a big problem in the city of Chicago. We've seen through recent research that there's an overwhelming demand for mental health services, and there's just not enough clinicians in low-income communities of color. We see the disparity actually is a ratio that we've seen where 22% of the city's residents living in the most affluent neighborhoods have an access of 4.5 therapists per 1,000 community residents, whereas low-income communities of color, low-income communities in general, have an access ratio of 0.2 therapists per 1,000 community residents. And so that's an enormous disparity we're talking about.
Matt Richards, the mayor announced in the fall, as we mentioned earlier, just over $9 million being allocated to 32 organizations on the city's south and west sides. Tell us about how that program is working to help those most in need of mental health services.
Thank you, Brandis. Yeah, the mayor's strategy has involved tripling the city's mental health budget in her first 2 years in office. So it's been a really significant investment, and we've been very focused on expanding care to service providers who provide care regardless of ability to pay, health insurance status, or immigration status. We made that $8 million investment in 34 community areas, primarily on the south and west side. All those services are up and running. They have been since October 1st of last year. We've integrated mental health professionals, or about to, across the city's 911 system for the first time. We're funding team-based care because not all patients, especially patients with more complex needs, may benefit from having folks come to them rather than them needing to come into a clinic. We've incorporated mental health services across the city's entire homeless shelter system. So we've been incredibly busy because we've tripled that budget. There's no doubt we have more work to do, but we're really committed to continuing to do it.
Amika Tendaji, of course, you're among the folks who are calling on the city to reopen those clinics. Why is this important when the city says that it is making investments in mental health through other avenues?
It's critical that we reopen the public mental health clinics because the private sector is not accountable. Pre-pandemic last year, we had aldermen and a team call the sites that the city said were available. Many were not. Many didn't answer the phone or respond in any way. We need public clinics so that we can hold someone accountable. In addition, it's Chicago with gentrification and police brutality that's causing and exacerbating mental health issues for its city. So it should take responsibility for healing Chicagoans.
Diana Castaneda, your organization C4 is among those receiving the funds of the city's investment. How has that impacted the work that you're able to do?
Yeah, it's impacted us in a variety of ways. I'll name two very briefly. One is it really helps us in the fight for equity. We've been seeing these issues for a long time. And so with the money that the city has allotted through these grants, we're working exclusively with 5 neighborhoods on the west side. So right now, anybody can call us and get services right away. The second way is that it's really focused on prevention services instead of crisis services. So we have a long history of doing crisis work well, but we're tired of only dealing with crises. We want to help people heal from the beginning. We want to help them get access right away. And so part of us allocating, because of the money the city gave us, allocating our resources has gone directly straight to 5 West Side neighborhoods, where again, they can call and get services right away, whether that's crisis, whether that's prevention, whether that's trauma and healing, whatever they need.
And Arturo, you've been conducting research related to access to mental health resources in the city. Is the need being met?
Absolutely not. This is laughable. I mean, we're talking $8 million. Let's put this into perspective. I'll invite your viewers to divide $8 million by 1.7 billion. Wait, that's the amount of money that the city is putting towards policing. We're talking about half a penny to every dollar that goes to policing is being invested in the city acting as a philanthropist. What we need is the city to take ownership of the problem, to reopen the clinics, to make those clinics the essential safety net for community residents from all parts of the city. What we found is even after this initiative has been implemented, we found that 86% of residents in a recent citywide survey said that they do not have enough mental health services in their community, right? Adding a few $100,000 to organizations does not increase the access to care where we have such desperate need for services in different parts of the city.
Matt Richards, I want to give you the opportunity to respond to that.
And I think our focus is really about strengthening the system that provides care regardless of ability to pay, health insurance status, or immigration status, right? That's over 200 health centers in the city of Chicago that are regulated by the federal government. It's community mental health centers that are accredited by the state. 5 of those over 200 are clinics that are operated by the city. We value those clinics. We've invested millions since the mayor has taken office. We've actually fundamentally transformed 4 of the 5 sites that needed a lot of additional investment. So it's not city services versus the broader system, it's both. And that's what we've done from the beginning, is investing in our own clinics, but then also recognizing that folks get their care in a lot of different places. And it's important for us to invest in those locations as well.
Diana, are you able to give a specific example of how the city's investment in C4 has been able to help you all provide additional services or increase capacity?
Yeah, and so really, as it's been talked about already, there's a huge workforce issue. And so what it's really allowed us to do is to take clinicians and have them dedicate their time and their energy to building relationships with schools, with the communities that we've been given the money to serve in kind of this equity thing. So certainly there's such high need in the city, and not resources can't go everywhere. What the money from the city is helping is that we're allocating the resources to the people who have often been harmed by things like institutional racism, by things like police brutality, violence, disinvestment in their neighborhoods. Our strategy is to focus directly more on those communities that have been traumatized in that way. Understanding we can't serve everyone, we're making choices to serve those that have been historically disenfranchised.
And Amika, what have you heard from the residents that you're organizing with about access to mental health resources in the communities where the clinics were closed?
Oh, there's not nearly enough, and folks really, we need the really recognize the need for public and accountable mental health clinics, right? To make sure things can shift from completely free of care to there's a charge if it's private, and our folks are really dedicated to it has to be public mental health clinics everywhere, access to quality clinicians everywhere for everyone.
Okay, that's where we'll have to leave it for now. Obviously an important issue for a lot of people. My thanks to Diana Castaneda, Arturo Carrillo, Matt Richards, and Amika Tendaji for joining us.
Thank you.